Hi everyone, welcome to episode 2 of Smile with Jamie. Today I have such special guest. I don't know if you can tell if I'm excited or not. I am. I've been following this cosmetic dentist for a long time on Instagram, and whenever I see his work, my heart starts to beat. So it's such an honor to have Dr. Marshall Hanson today with me, and we're
Thanks,
just
Jamie.
gonna all dive into the world of composite veneers. Thank you so much for joining me today.
Yes, you're welcome. Thanks for the invite.
So if you can just briefly introduce yourself to the audience and where you are right now.
Sure. So I'm Dr. Marshall Hanson. I have a family. I have a wife and 4 kids and currently work in Utah. I grew up in Idaho. My wife is from Canada. She is from British Columbia, Alberta when she grew up. So I have been up to Calgary one time. So we like Canada. And I work as a dentist and I love it. I love the artistry. I love the science. I love that it can be meaningful to
Yeah.
individuals who are looking to improve things about either the health or the looks or the function of their teeth and their smiles. So I feel very fortunate to have found a work that I really enjoy. I don't know if that's all you want to hear about me.
Yeah, that's amazing. I've been following you on Instagram for a few years now, and I just remember like looking at your work and oh my gosh, this is what I want to do. Every time I look at your post, I'm just like, oh, he is the god of composite veneers. I don't know, something about your work. I see a lot of composite veneer work on Instagram. It's just like something about your work is like it moves me.
Different.
So
Oh, thank you.
yeah, it's super special, and I'm so grateful that you're here. You had that interest in cosmetic dentistry early on. Tell us a little bit about that and what inspired you.
So as a youth, I always loved to draw and sculpt and make things with my hands, but I never thought in the future I could support a family as an artist. You always hear about the starving artists. So my mother was a nurse, and so we would talk about healthcare and I loved learning about the body and health and biology, nature, things like that. And so when I got into university, I thought, well, maybe I can, if I can't be an artist, maybe I'll do something in the field of healthcare. Thought about being a health teacher for a while, and then I just figured out if I'm going to go into healthcare, I might as well just be a doctor. So that was my path. I was pursuing medical school and preparing for that. And it wasn't until just a few weeks before I took my medical entrance exam, or the MCAT, that I had an exposure to dentistry. And I didn't know much about dentistry. I was kind of on a whim. I had a family member from my wife's side who was managing a dental office and just invited me to come check it out. I learned enough about learning about the medical field that I knew I needed to specialize in something, that I needed to be really good at one thing to be helpful to people. And so I was kind of looking at different specialties, and I thought, well, maybe you could consider dentistry as a medical specialty. So I went and I observed this one dentist, and he happened to be a cosmetic dentist in Arizona. And I didn't know much about what he was going to do. And I got there early. He brought in his patient, and I knew his patient. I was aware that she worked for a plastic surgeon. She was probably in her late 40s, early 50s. And she was otherwise really attractive lady, but her teeth were dark and misshapen. And so I noticed that. And then he talked to her for a little bit, sat her down, and just started doing his work. And then after a few hours, he was preparing her teeth for 10 porcelain veneers. And again, I didn't even know what that was at the time. But what stood out to me and impressed me and really had an impact on me is at the end of that appointment, he handed her this mirror and he sat her up, and he had made her some prototypes or some temporaries. And when she sat up and she looked in the mirror, and I was just watching her, and I could just see in her eyes as they started to well up what this meant for her. And she reached over and grabbed Dr. Harris's arm and just looked at him in the eyes, and she's just like, thank you, thank you, thank you. And I was watching this, I'm like, wow, like that was really impressive that I could just see what she felt he had just done for her. And in my heart, I was like, wow, if I could do something that's that meaningful to someone else and serve them in a way like that has that kind of an impact, like that really got me excited about maybe doing something in dentistry. And then as I looked more into it, I saw there's lots of artistry in dentistry, and so it soon became a really good fit for me. But that experience of seeing someone else enhance another patient's smile and what impact that had on their life just called me, and I'm like, that's the kind of work I want to do. And so even before I got into dental school, I knew that's what I wanted to do. So I went to the University of the Pacific in San Francisco, and I just all 3 years that I was there, I just absorbed everything that I could, created every opportunity I could to learn more about smile design and anatomy and anything I could do about that because I knew that's what I wanted to focus on. And I had a great experience at UOP. I did actually a lot of cosmetic dentistry in dental school. I did over 100 units of fixed work. I did multiple full mouth cases, multiple veneer 10-unit cases. I even did composite veneers in dental school. So I had a lot of experience there. It was a great experience for me. And then I left school feeling confident, but as most new dentists know, when they get out of school, there's still so much to learn.
Yeah.
So I got into practice about 8 months. I got a job working as an associate, out of school in Arizona. And about 8 months into that, I decided to kind of do my own thing and buy a practice. And so I was just working my own office for a couple years and just trying to figure out the whole business side of things, as well as develop my skill sets to do general dentistry. When I was in dental school, one of the things that really helped me was I was exposed to the Journal of Cosmetic Dentistry, which is put out by the American Academy of Cosmetic Dentistry. And I was just floored when I saw those images, because I had already looked at any book, any magazine that I could find about dentistry, and I could kind of see what level of work, you could see what they did. But when I saw that journal, the quality of work was so different. It was like undetectable and so beautiful. And when I saw their work and learned about their accreditation process and the doctors who are doing this level of work, I'm like, that's what I want to do. I want to be able to do work like they do. And so in dental school, I made it a goal for myself to work to become accredited in the American Academy of Cosmetic Dentistry and then become a fellow. And if you're not aware of what that accreditation or fellowship process is, basically it's the closest thing in the United States that someone can accomplish to be recognized formally as a specialist in cosmetic dentistry. And so there's a written exam, there are a number of different cases that you document and you submit to a board of examiners, and you either pass or fail. You have to hit this level of excellence, and then there's an oral exam. And then, so you do that all for accreditation. You do 5 different cases for that. And then for fellowship, you do that process for 50. That incredible. Was a really good mentoring process for me, because it really has a very formal, clearly outlined criteria and what would I say, like a level of excellence that's very standardized. And so there's all these criteria that you have to meet to reach that level. And so I was able to look at my photographs of the cases that I was trying to do early on at a dental school, and I could compare all those points of reference to my work and my photographs and see what I was missing, see where I needed to improve things. And over years of time, starting to train my eye to see things that I just didn't see before, whether those emergence profiles or embrasures or inclinations or proportions or gum tissue health and zeniths and all these different things that were new to me at the time. So that whole process of accreditation and fellowship really trained me to be able to see things and what I believe to put out a higher level of aesthetic dentistry. And I think if I were just to summarize the whole accreditation process, it's can you do dentistry in a certain way, at a certain level, to where it's undetectable? So where you can do dentistry and the average person can be like, I don't see the dentistry. Like, to me, that's like the highest level of dentistry that we can do. Because most dentists can like fill a hole if there's a cavity. But if you can do that in such a way to where it becomes undetectable and it looks totally natural, like, to me, that's always what I was trying to aim for. And so I learned a lot from my photography and going through that process of accreditation and learning to do my own braces, learning to place my own implants, do my own bone grafting, do my own ceramic work. Like, I was my own lab for 10 years working toward this process, and all of those things just taught me so much. And it's interesting because I'd always just thought I was going to do general dentistry with a focus on cosmetic and undetectable work, until just maybe 4 years ago when I made a shift and I decided that the only procedure I was going to do moving forward was direct composite. And I can get into the reasons of that, but And over the time, I know I've been
Wow.
talking for a little while, so
No, that's
your
okay.
turn.
Yeah, well, you've kind of segued into the second question, but I just wanted to check in about your dental school program. Like, was your program more heavily like available for those type of like full mouth reconstruction, cosmetic types of
Yeah,
work?
so
Were you just like driven, I'm just gonna get all the all the stuff out?
I I think that there was a combination of those things.
That's
So at
good,
the
yeah.
University of the Pacific, they didn't really have specialty programs there. So there
Mm,
wasn't a pros program or yeah, so
yeah,
almost or there wasn't an endodontic program. So most all the complex cases didn't get traded off to some under or postgraduate
mm,
program. We had to treat those. So anything that came in was ours to figure out. The neat thing about the school there is there really was an ability. So if you had an interest and you had a focus in root canals or in
yeah,
surgery, the professors would help create opportunities for you to do more of those things. So I think I had a passion and I was driven for that, but I also think that the structure of the program opened things up for me to do more of what I wanted. I had other friends who really loved root canals or really
yeah,
loved surgery, and they had so
yeah,
much experience in those particular aspects
yeah.
and were able to leave dental school feeling very confident.
That's really good because, in a way, that's actually better not having the specialty programs in your faculty. Because
Mm.
I graduated from Toronto. First of all, a lot of things are ancient. I don't know how things are now, but things were the same for like 100 years or something. The instructors were like, oh, the lab was like this when I was in dental school. I'm like, oh my goodness. And then we have all of the 10 specialties within the faculty.
Mm.
So we were encouraged to refer to the graduate
Yeah.
students. In dental school, my only goal was to just graduate, survive,
Yeah.
meet the criteria. So it was a different kind of journey, but that's really cool that you had cosmetic dentistry as the goal even like before you entered dental school, so because you're so
Yeah.
focused on it, you could utilize all of the resources that was available in dental school.
Mm.
And it's really inspiring to me that you pursued the fellowship because you make it sound like it was easy peasy.
No, it took 10 years. Like it took 5 years of work to do accreditation and another
Oh my
five for
goodness.
fellowship.
Yeah.
But again, it was just so full of learning opportunities that just really stretched me and helped me to become
Yeah.
better.
So did you have like specific mentors from school or during that process? Or were you
No, maybe that's
taking notes?
a chance where I didn't really use my resources. And it's interesting, like I was a new dentist and I was trying to run a new practice. And
Yeah.
I think so much of my focus was there, like in those
Mm,
walls of that practice. And I didn't really get out of that practice very often or much. And so even as far as like having a network or mentoring. So my biggest mentor really became my photography. Like I would take
oh,
pictures of
yeah.
my cases. I took pictures of everything. Even when I was in dental school, they would always say, oh, there's Marshall. He's got a camera around his neck. I had the camera
Mm,
with me all the time. I learned so much from that. But so yeah, my mentor was my camera. So I would take photographs of my cases. And for me, I would look at my class 2 filling or my occlusal filling or
yeah.
my implant or whatever I was doing.
Wow.
I'm like, okay, well, can I see the dentistry that I just did? And if
Yeah.
I can see it, what gives it away?
Yeah.
What about it makes it obvious that that is dental work? And how
Yeah.
can I change that so that it's not obvious, so that I can't
Yeah.
see it? And then that got me into doing my own ceramics and
Oh my goodness.
doing my own lab work because that became more predictable for me. Like I knew what I needed to do to change it. And it was so hard for me to communicate that to laboratory and like get it back. And so I
Yeah.
I enjoyed making it myself and doing it the same day, and I could customize the colors and the contours and the contacts. And but again, I
Wow.
learned so much from that. I learned about prep design and I learned about
Yeah.
thicknesses of materials and
Yeah.
different kinds of materials and how to finish and how to create anatomy and line angles and how to do
Yeah.
surface texture. Like all of those things I had to learn because I was now the lab tech doing the work. I would just look at my pictures and that was my biggest mentor. And there's a
Yeah.
lot of good doctors out there who are happy and willing to help. And so I think if you're in a space where you want to learn more about a
Yeah.
particular thing, I would encourage you to find a
Yeah.
mentor. I think
Yeah.
that's even better, but I didn't. At that time I just studied my photographs, and that became my biggest teacher.
Yeah, that's really cool because I recently, just last year, I was like, cosmetic dentistry, I want to do this. And I didn't even know about AACD, accreditation, like these are all new things, but I'm really realizing, okay, photography is so important. So I started taking a photography course. There's so many C
That's
courses
great.
out there nowadays.
Yes, there are.
And I'm just like, I don't have all that money, but I asked that question, like, what is the right next step? And to me, like, photography was clear. Some of the courses that I took, like composite bonding courses, they have amazing photography, and that's how they detect different line angles, and that's how they
Yeah,
teach. And so I was like, okay,
yeah.
I need to get my photography up. I think that's really great that photography is a great mentor to start with.
Yes. I just didn't have any money either when I was younger, out of school trying to operate a
Yeah.
practice. And so the only event that I could go to, CE, outside of my dental practice was once a year I'd go to the AACD event. And it was like
Mm,
3, 4 days, but that's all I could really afford. And so
yeah.
I had to rely on my photography and any
Yeah.
online CE, any books. If I can just buy a book, I would read a book and
Wow.
like learn what I
Yeah.
could from
Yeah.
that
Yeah.
because I couldn't afford to leave my practice. I couldn't afford the CE leaving.
Yeah.
So that's what
Yeah.
I did. And you can, if you're motivated, you can learn a lot that way.
That really reminds me of that quote. It's not about how many like resources you have. It's like about your resourcefulness.
Uh,
And so if you have the goal and passion, then you can make things happen. Because I think a lot of us kind of feel like, oh, we don't have the money, we don't have this, we don't have time. But
mm,
clearly from your story, you were driven and you just needed to make that happen. So really inspiring. And what made you specialize in composite veneers? There are so many different types of porcelain veneers that you can do, cosmetic
yeah.
work that you can do.
So
Yeah.
when I was going through that accreditation process, there's 5 different case types you do for the original accreditation. There you have to do 6 or more porcelain or indirect veneers, and that
Mm-hmm.
teaches you how to design a smile with a lab technician. In case type 2, you do 1 or 2 ceramic indirect restorations, and that teaches you how
Mm-hmm.
to work with a lab tech to blend things in with a
Mm-hmm.
natural dentition. Case type 3 is where you replace a missing tooth in the front with an implant or a bridge, and so that teaches you how to manage tissue and again work with the lab and blend things in. Case type 4 is where you replace a large portion of a front tooth with direct composite. So that has you demonstrate how you can manage the different composite materials and how you can blend that
Mm-hmm.
into a natural tooth. And then case type 5 is where you do 6 or more direct composite veneers. And again, that demonstrates your ability to design a smile yourself on the patient directly and manage the composites and anatomy and
Yeah.
things like that. So those were the 5 cases that I was working on, and I was
Mm-hmm.
documenting those. And I felt something as I was going through that process. So even though I was doing the porcelain veneers and I was doing the composite veneers, like I was the artist for both of those types of cases, I felt differently. I felt
Mm-hmm.
different. Even though like when I did a porcelain case and I liked how it looked in the end because I made it, I still
Mm-hmm.
felt heavy inside knowing that I had had to shave down their teeth to accomplish
Mm-hmm.
that. Most patients who were looking for cosmetic work had already relatively healthy teeth. They just
Mm-hmm.
wanted them to look larger or brighter, or maybe they'd been chipped or worn down a bit. I just felt heavy having to prep down their teeth and shave away their enamel to accommodate my
Mm-hmm.
porcelain. And I also found too that when I compared my composite cases with my porcelain cases, that I just felt that the composite looked more believable. It looked more natural
Yeah.
than what I could do with porcelain. And then I also didn't feel that heaviness when I was doing a composite case. I didn't have to shave the tooth down. And so I felt better. I felt like I could kind of rejoice and celebrate more with the patient at the end because I just felt lighter about it. And so I knew that there was some advantages. There was some real positives about composite. And again, because my eye was always trying to find how I can make these more believable, how I can make them undetectable, composite just was more believable for me. The way that it
Mm-hmm.
looks more like tooth
Yeah.
structure,
Yeah.
and then I didn't have to shave down the teeth, but there were a lot of complications, a lot of challenges that came with direct
Yeah.
composite to where like the material would discolor or it would stain or it was chipping or it was just
Yeah.
difficult to put in all those layers. And then like I would spend all the time layering in all those composites, and then I would show the patient, and then he'd want to shorten them. And so we'd shorten them a little bit because maybe they were a bit long, and I'd lose the halo, I'd lose
Oh
some of
my
that translucency
god.
effect that I'd spent all that time working and put
Yeah.
in. Or I would work on putting in all these layers, and then by the time I finished and polished everything, I had thinned out more on one side versus the other, and so I could see more of the internal effects on one tooth versus
Yeah.
the other, and it wasn't consistent. And I was like,
Yeah.
man, I just put all that work in and all this time layering these little layers, and then it still doesn't look right. And so it just became frustrating. It was unpredictable for me. And I just felt, though, I felt so strongly about preserving tooth structure and creating something that was beautiful and natural that I was just driven to find a way to create solutions to these challenges. And so over the last 10 years, I've been evolving methods and techniques to overcome those challenges of staining, chipping, discoloration, the challenges of layering, masking out tooth color, and matching composites to teeth. And so over these last 10 years, just being driven to do that in a non-invasive way, I've finally gotten to a place where I have a systematic, almost like a recipe now, that I know that whatever comes in, I can apply these steps, I go through this process, and I can achieve a very predictable, aesthetic, beautiful result that's completely non-invasive, technically reversible. And I feel so good about that. I love that we can enhance smiles without removing enamel. And to me, that's one of the things that I really want to share with the dental profession. I want to prove that we don't have to remove enamel to make beautiful smiles, and we can make extremely naturalistic restorations for patients that can hold up really well over time, that aren't going to stain, that aren't going to chip, that aren't going to lose their polish. And there's ways to do this. And so that's what I'm excited about. And when I was getting into recognizing that this was working and that I was overcoming so many of those challenges that I'd had with composite, that's 4 years ago when I'm like, okay, I think this is what I just want to do, this one thing.
Yeah.
And I want to go really deep with it. And so that's when I started doing a lot of my own research.
Yeah.
And now I'm to the point where I'm writing a textbook now about this whole process, all the science and the research that I've been doing about this process. And now being able to share that with my peers is exciting for me. I'm excited about the project of this textbook and putting it all together now.
When is that coming out?
Well, I'm hoping to finish all the writing, all the text by this summer.
How
and
thick
then it's
is
just
it?
It's a lot of pages. Yeah, it's going to be a lot. But there's just so much. There's just so much to share. So many questions. And there were a lot of issues. Like, there were a lot of things about these methods and techniques that I was developing for this process that didn't have answers in the scientific literature. No one had studied these things and doing it this way. Because I had questions and I couldn't find it in the literature, then I had to do my own research. So fortunately, I've been able to go to Ultradent. They're here in Utah. They're a company that produces nice materials for dentistry, and they've allowed me to come every other Monday, and I can do research there. So I get to test things. I can test bond strengths. I can test flexural strengths. I can do lots of different things to test out these protocols.
Different brands of composites?
So initially I started off doing that, but it became clear to me early on that every composite is so unique. The chemistry is so unique in each composite. If you ever look at a list of composites and see what ingredients they're in, they're all different. And the chemistry makes a difference when you're testing things. I could do one test on one composite and get a totally different result doing the same test with a different composite just because the chemistry is different. It became clear to me that most of composites out there do stain, do discolor, do lose their polish over the time. And there are very few that don't. There are very few that hold their polish and their color over time. And so those are the composites that I've been studying and working with, because those are the ones I want to work with. And so I've really only been studying now recently just one or two materials, but in a lot of different aspects of it.
Did you ever have to remove all your work?
So I had one case.
One case
where I removed all of my composites, and it was really interesting. It was more of a psychological thing. So the patient had two front teeth that were a little more prominent. Her laterals were tucked in, her canines were prominent, and then her premolars were tucked in. And so we just kind of brought everything out into alignment, made them just a little bit brighter and made the edges right. And to me at the time, it was one of the most beautiful cases I had done. Like, I loved this case. Anyway, the story is that she loved her teeth. She was really happy about everything. And then like that first week or two, she ran into someone that she knew at the grocery store, and her friend was like, "Oh, you got your teeth done. They look so nice." nice. But what she heard in her mind is that, oh no, she noticed that I had my teeth done. So if she notices, then everybody's noticing. And if everyone notices that I got my teeth done, they must all think that I'm vain. And I just can't handle everyone thinking I'm a vain person because I don't view myself that way. When we had conversations on the phone, I'm like, oh, we can change them. We can, modify them. And she's like, no, I just feel like as long as I have something on my teeth, other people are going to be thinking that I'm vain, and I just can't do that. And so that was the one case that even though they were so beautiful, I removed them all off. It took about 5 hours because it's a careful process. And I truly wanted to prove that this is reversible, like that you can go back to your normal tooth structure. So it's a careful process. It took a number of hours, but I documented that and it can be done. But that's the only case where have had to remove them. So I know it can be done, but hopefully it won't be something that's common.
I know like people who come for cosmetic work, they start looking at their teeth a lot now. How do you set their expectations so that you deliver and satisfy?
My process has evolved a little bit over time. Early on, I used to be very involving with the patient in their design. So I would say, okay, here's all the different colors. Like you can pick, here's a more natural, here's a brighter, here are all these colors. You pick which one, and I'd let them pick the color. And then I could show them pictures like here's some masculine teeth, here's some rounded teeth, here's oval teeth, like which one you can pick. And I feel like that created problems because I'll just share one example. The one case I remember, I gave her a selection and she was trying to pick between two different shades, and one was a little more natural, one was a little more white. And in the day that I was doing all the work, the buildups on her teeth, she was just an emotional wreck. She was so worried that she had made the wrong choice, that she picked the wrong color, and she was emotionally just so distraught. And it doesn't really matter now because I can modify things, so it wouldn't have mattered anyway, but because I handed that off to her and let her make that decision, she was worried about that. So now more of what I do is I in my very first appointment when I'm sending the patient down, I just let them share with me anything that they know about their teeth, anything that stands out, if they could wave a magic wand and make things different with their teeth. And I just let them share everything. And so they'll point out things that are important to them. They're like, I really feel like these teeth are too small, or I don't like this gap, or I feel like this canine is too pointy, or my teeth are all discolored. So in my mind, I'm collecting these cues, okay? Certain things that I can tell that they like, and then I will choose to weave those into their design in an appropriate way. So I won't do anything that I don't think is that if the patient says like, oh, I just want them all really flat and straight across the bottom edge, or I want them like really, really white. I think patients don't necessarily know how to word things, how to describe it in a way that we would describe it. It's not the same. And so if they say, I just want everything straight across, in my mind, I might be thinking, okay, they want all the edges to be totally flat and that's not going to look good, right? So in my mind, I'm like, okay, well, how can I weave that straight concept in an appropriate way so it still looks natural, still looks believable, but there's a suggestion that things are straighter, So I give my patients less involvement. I just let them share everything. I repeat it back, and these are the things that are important to you. And then I choose to weave things in. I don't let the patients pick the colors anymore. And I think for me, it might be a little different too, because most of the clients that are coming to me are coming because they've just seen my work on Instagram and they already like that style. If they didn't like that style, they would go see someone else. So it works for me because I know that if I do my style and I do what I think it works for them, I think they're already going to be happy because they're already here because they like that style. So that works for me. But I think that in a way it's comforting. Like if you go into a hairstylist, for example, and you're just like, you're the artist, just do what you think's going to look good on me. And they're like, yes, I know exactly what to do. And they do it, and they do it confidently. There's some comfort there. Like you trust them. You like that. Whereas if you go into someone and they're start asking you, oh, should we do this or should we do that? Then you're like, well, I don't know. Like you're the professional. You tell
decide.
me.
Yep.
So I think that there's some level of psychological comfort and confidence that can come when a patient comes into you. You say, okay, I understand these are the things that you want to accomplish. I got this. I'll do it.
Mm.
Let me just
Yeah.
do it. I'll do my thing. And
Yeah.
they're like, okay, they know what they're doing. They're going to handle it. And I think
Yeah.
being able to do that does come from confidence and education and building your skill set to where you know you can handle those things. So things can get easier as far as setting expectations go.
Yeah.
And I
Yeah.
think it's important too, just to be totally honest with patients about all the possible things. I think early on, especially when I was treating patients, like I didn't want to tell them all the negatives that could be happening. Like if I was going to prepare their teeth for a porcelain crown or porcelain
Yeah.
veneers, I didn't really want to go into the details of what I was going to have to do to their teeth because I didn't want to share that.
Yeah.
But I think the more honest that we can be, the more open we can be from the beginning about the risks versus the benefits and just being really clear about that, that establishes good expectation. Because if you're like, okay, I can prep these teeth and there's a possibility that this tooth could get inflamed and it could need a root canal. That's a risk. Just need to know that. And so if you tell that ahead of time, then if that does happen, the patients are like, yeah, this is unfortunate, but you told me that this could happen. But if we hold back and we never tell the patient that prepping their teeth could cause a root canal and then it does, then they're upset. And they're like, you did this to me, right? So I think just being honest with your patients, being as clear and open from the very beginning as possible is helpful in setting expectations and having satisfied, happy patients. And always just doing your best work. Just do the best you can. If you know you could do better, then do that better. Don't try to cut corners. Schedule yourself so you have time to do your best work. And I think that that's another way to really help have happy patients and to meet expectations, because once we start cutting corners and doing things that we think, okay, maybe that's good enough rather than this is my best, I think that's where we set ourselves up for problems and patients for dissatisfaction as well.
So do you give patients options of porcelain veneers too, or is it just strictly composite veneers that you do?
So I used to, when I was doing general dentistry, I would say, okay, here's the pros and cons of porcelain, here's the pros and cons of composite, you can pick and we'll just do whatever you choose. But now, over these last 3-4 years, I've made a decision to only do composite because I believe in it. I believe it's more beautiful. I believe it's non-invasive. I believe that it's maintainable over time. And I just have all the confidence in it as a material and as an option for restoring teeth. I would never go back. So it's the only thing that I'm doing now. And I'm just going really deep with it. I'm exploring all the aspects of it. I'm starting to develop products as well that can help other doctors do this method easier and more predictable. So right now I'm just doing composite and really focusing on it. I believe that in the coming years, this is how cosmetic dentistry is going to be sought after. I think people are going to want something natural and they don't want to shave down their teeth, and they are going to be the catalyst because they're going to be requiring it of their dentists and say, this is what I want. And so the dentists are going to be faced with that. They're going to be like, okay, well, I either have to learn this or I'm going to have to refer because my patients don't want to have their teeth shaved down anymore. They want it to look beautiful and natural. They want it just to maintain it rather than replace it over time. So anyway, I believe that this is how cosmetic dentistry is going. And I think if we can have answers to our questions about the process, about the materials now, it'll make that treatment option more predictable from a delivery standpoint as well as from a patient receiving it and then maintaining it over time. So I'm excited about it.
I really resonate with that because when I first encountered your work, I was like, I think this is where things are going to go. I recently had a patient who came in and she was intimidated by that word veneers. So even when I said composite veneers, she's like, whoa, I don't want to do veneers. And I said, it's also equivalent to like composite bonding because we just add on to your teeth. And so she like calmed down. But people just searching for minimal invasive treatment that can be as natural. So that's why I just want to hone in my skills more into that area. I didn't know until recently that you can have fillings that could last years. You don't have to replace every 2 to 5 years. It doesn't have to stain every 2 years. So those concepts were just so revolutionary to me. And so I'm like, okay, if that's possible, then I can learn and I can do better and improve my skills. But a lot of us might still feel like, oh, because it's Marshall Hanson, you know, he's got the hands, he's got the skills. That's why he can say it so confidently.
Just to add to that, like, I didn't always have that. Like, I remember my first wax ups in dental school. Like, it's just been something that I have been working on because I believe in it. And so I've been out of Adam dental school for like 15, almost about 16 years almost. And I've
Mm-hmm.
just been focused on it. So it takes time. It does. And that's
Mm.
true with anything, whether you're a basketball player or you're an artist or you're a photographer. If you just have to work on your skill set, you have to practice it. And it's not like you
Yes.
either have it or you don't. Like it's something that if you believe in it, you put the time in, you can
Yeah.
get there. So I think
Wow.
it's just a matter. I feel like I have done courses and I've shared these techniques and concepts with a lot of doctors. And I think the only ones that are really taking it and making it work for them are the ones who believe in it enough that they're creating space, a time in their busy work schedules to
Yes.
practice it. And if they practice it, the ones that I've seen do get better and better and better. Like their cases this year are better than last year's. And that's the same thing for me. Like the
Mm.
cases I'm doing this year are better than they were last year. And I hope that that continues. I hope that we continue to improve and improve and
Mm-hmm.
improve and get better.
Yeah.
So if you don't feel like you have the skill set, but you have the passion, you can get there.
You know, work
Just
at
set
it.
some
Yeah.
goals, create some time, a little bit of
Yeah.
time every day or every week, and you'll get better.
That's really encouraging and hopeful for people like me who might be just kind of starting out and wanting to get to where you are eventually. Yeah, I just wanted to talk a little bit about, you teaching across the world and traveling with your family. Is that something that you kind of envisioned early on, or is it something that you kind of just came about?
So, teaching is an important part of improvement. When we know that we're going to teach something, we learn it different. We ask ourselves different questions and then we hold ourselves to a higher standard because we're like, okay, if I'm going to do this and I'm going to share this with my peers, it's got to be really good, right? And so it pushes us. And so I feel like teaching, I felt, has always been a part of what I knew I needed in my practice and
Mm,
in my profession to
yeah,
become better. To answer your question, I've always felt like teaching would be a component of
part
what
of
I
it.
do.
Yeah.
I don't think I would ever switch and just only do teaching unless I couldn't work with my hands
Yeah.
because I love creating. Like I love
Yeah.
making things and that's so meaningful. I had set a goal to start writing on this textbook over a year ago and I thought, well, I'll just work on it in between patients or
Yeah.
on the weekends and things, and it just never happened. So I
Uh,
found that I had to get away from the clinic. I had to get away from my practice to actually focus and write the text.
mm,
And so that was part of the concept of, okay, well, let me leave. Let me go away from where my
mm,
practice is. Let's go somewhere
yeah.
else.
Yeah.
We can give our family an outside of the
Yeah.
US experience. And then I can just focus on writing this and put textbook and putting these concepts together for my peers. And so that was part of why I was traveling. And then
Yeah.
also because I can't work as a dentist in another country, but I can teach, it made
Mm,
sense to do some courses. So I can teach while I'm there. We'll support ourselves that way, and then I'll just
yeah.
work on this book. That part of traveling and teaching has been a bigger part of this year
This year.
because of the textbook than other years. I don't see myself traveling as much in the future as I am this year.
The other question that I had was about the importance of learning occlusion because
Yeah.
we don't want fillings to come back with like chips everywhere, have to replace it,
Yeah.
repair it. And so I started going to Kois Center and it's a big, big, big commitment, investment. Was it something that you also like learned occlusion, one of those big institutes, or something you read
Yeah.
from books? I don't know.
So actually, yeah. So again, I didn't have a lot of money in the beginning. I think I was one of those doctors that was so focused on doing the dentistry. And
Yeah.
I loved that part of it. I didn't really
Yeah.
like the business side so much, so I just didn't put as much effort into the business side of things as I was
Mhm.
into the clinical delivery and the technique part of
Yeah,
it.
yeah.
So anyway, I didn't have a lot of money, and so the best book on occlusion that I read was Peter Dawson's TMJ, or Functional Occlusion, TMJ to Smile Design. It's an orange book, and I read that cover to cover, and I just love that. And I wrote pages, I filled the whole notebook full of
Wow.
notes and ideas from that book.
Yeah.
And still today, most of the concepts that I use in managing occlusion and the forces over time come
Yeah.
from the principles in that book. So, and I know that Kois incorporates a lot of those same principles. I think
Yeah.
There are just true principles in the world. Like you can find them in lots of different places, but they're going to be common because they're just true principles when it comes to
Mm,
biology. And so to answer your question, I read that book and I love that book. I'd recommend that to anyone who learns well by reading, wants to learn about occlusion. I think it's really well put together, and it's something now that I can incorporate in on every case, on every
mm,
patient. And I think it's important to discuss the concepts of occlusion to your patients,
mm,
because really there's just two main factors that influence the longevity of what we do, either of dentistry
yeah,
or even people's natural teeth. And those two factors are bacteria
yeah,
and force over time. And I think as general dentists, we tend to focus a lot on bacteria, and the consequences of bacteria on decay and periodontal disease and things like that.
mm-hmm,
I think we tend to neglect a little more generally force over time and
mm-hmm,
how we can manage that, because there's a lot of things that can fail early if we haven't addressed and managed forces over time.
mm,
So there are very simplified, really practical ways that we can incorporate that into our workflow. And it's so important. It's just as important as managing bacteria to help things hold up well over time and
yeah,
empower your patients to know
yeah,
how they can handle things on their own, on their home care, and
yeah,
what to look for,
yeah,
so that they can upkeep not just their natural teeth, but everything that you've done, or maybe things
yeah,
that they've already had done and they just want it
yeah.
to last longer. So yes, occlusion is huge.
So do you do Invisalign or like alignment treatment before you do composite veneers?
Yeah, I would say about 10% of my clients need
Okay.
Invisalign first. And it's mainly because I want to prove and show that we can do this in a non-invasive way. So if teeth are such that they're out of alignment to the point where I would have to reduce the tooth to bring it back into alignment, that's my flag. That's like, okay, we're doing Invisalign first to get the teeth in the right position,
Mm,
so then we can restore them and keep it non-invasive. So if there's a spot or a tooth that I would have to shave down, I'm not doing that. So we'll
oh
do the
wow.
Invisalign first. But yeah, I would say about 10% of my patients need that. And I might have a little different clientele. Most all my patients have had braces before, and they're
Okay.
coming to me because they want to preserve their teeth. They're
Mm-hmm.
already trying to take care of things. Things are relatively
That
lined
makes
up
sense.
already, but it fits into my non-invasive philosophy. Getting
Mm,
teeth in the right position, then we can
yeah,
enhance them and keep
yeah,
it truly reversible.
yeah. So you said a lot of your patients fly from outside of the state. How do you
Yeah.
do the Invisalign treatment prior to? Or do you tell them when they're in your chair?
My workflow is the first thing that we'll do is a virtual consult. So they'll send me
Mm,
photographs or maybe even a video or some x-rays of their teeth. And then I'll put together a video response for them going over their goals and how we'd
yeah.
accomplish those. And most of the time in photographs or a video of their phone and from their phone and how their bite comes together, I can assess and say, okay, yeah, we're going to need to do Invisalign first. The really cool thing about clear aligners and orthodontic therapy
Mm-hmm.
today is that we can accelerate orthodontic movement. Not that we put more force on teeth than we used to, but we can stimulate the bone so that your body sends more cells that can create the
Wow.
bony
Yeah.
changes more efficiently. So most Invisalign cases take 3 months. Most people don't want to do braces. They don't want to do Invisalign,
No.
but a lot of them can get their mind around 90 days. So, okay, maybe I can do 90 days and protect my teeth and
Wow.
then
Three
finish it up.
months.
So we can
That's
do a
amazing.
procedure called micro-osteo-perforation, or MOP. You can find it in the literature under accelerated orthodontics. And basically it's a stimulation of the bone between the roots that allows your body to send more osteoclasts and more
Mm-hmm.
osteoblasts, which are responsible for the bony changes so that tooth can move. And so generally with Invisalign, for example, when we would usually have them wear an aligner for 2 weeks,
Mm-hmm.
they can now do this procedure and wear an aligner for 5 days. And so they're taking a 14-day down to 5 days, and
Five
we're
days.
taking it
Wow.
a 12-month plan, which is really common with Invisalign, and now
Yeah.
we're doing it
Yeah.
in 3 months' time.
Wow.
I mean, it works very predictably. I've been doing that on all my cases for the last 7 years. It works
Wow.
very predictably. It's minimally invasive, generally
That's
not even any
amazing.
bleeding involved, and it works really well. So
Wow.
so that's
That's
how I can
amazing.
do it long distance. Is they'll come out
Yeah.
for 3 appointments, one to gather all the records for the Invisalign, the second one to deliver the Invisalign and do the stimulation acceleration procedure,
Yeah.
and then 3 months or 4 months later, they're coming back to finish the Invisalign, balance their bite, and then do the smile enhancement with composite.
Wow. That's amazing. I'm so sorry. The sun is like blasting on my face. Just give me 10 seconds. Thank you.
Oh
Calgary
yeah,
is one
sure.
of the sunniest city in Canada, and
Oh wow.
it's
There it
it's
is.
proven right here. Yeah, that's amazing that you can do Invisalign in 3 months and you have that system. And is that something that you touch upon when dentists take your course, like your
We can
kind of
talk about it.
systems?
There are
Yeah.
formal courses that you can take, usually a multi-day course. You can also read about it in the literature. There's documentation to show how to do the process.
Wow.
And so it's not complicated, but you just have to be smart about it. With these perforations, you don't want to touch any root surfaces. So there is some training involved, but it can be done safely and it can be very effective.
Yeah, thank you so much. I'm aware of the time. I feel like I need to have you on again in the future. But yeah,
Sure.
we can
My
literally like
pleasure.
go on and on talking about dentistry, I feel like.
I know I love talking about dentistry.
It's clear to me that you're very driven and passionate about composite veneers, and it's gotten you to where you are since day one when you shadowed that dentist smile transformation. And I heard from the other podcast that you were very creative in your ways and you owned a clinic, but then you sold it, and then you're now renting an operatory, and
Oh, yeah.
like all those things are super new to me, and it's really innovative. And I feel like that's one of the beauties in dentistry. Like you can create your own
Mm.
paths, and there's so many different ways to go about it. Your story's been super inspiring, and I love that how creative you are and it fits into your lifestyle.
The one concept that I would share is that, and that's kind of led me to where I am with the process of with direct composite that I'm doing now, is I would have challenges, right? I would have
Mhm.
things that were unpredictable or frustrating happen. Instead of dwelling on that, my thought went right away to like, okay, well, what can I change? How can I change the system or the process to prevent that from happening again in the future? And I think even as far as the business model that I work with right now, it's been a product of that too. I'm like, okay, well, maybe this isn't working so well. How can I change the system? How can I change the
Mm,
structure or the model to make it work, to make it better? And so I think we totally have that ability as dentists in our environments,
mm,
whether we're owners or we're partners or we're associates or whatever the situation, there are things that if we don't like them, instead of just complaining about it, and we can be put our energy into finding creative solutions.
yeah,
And when you do that and you
definitely.
open up these new doors and you solve problems and you eliminate the chances of those from happening again, or you minimize those chances, then your life just becomes freer. Like you're less weighed down by those burdens. You feel more like an agent to act. You're not just being acted
Mm,
upon anymore, and you can make things happen, and
yeah,
it's empowering and it's exciting, and it
yeah,
it feeds into your passion. So
yeah,
I don't know, I guess I would just say if you find you feel like you're stuck in some situation,
yeah,
put that energy into a creative solution, maybe something that you haven't tried before. You have the ability to change the way you do things and look at things
yeah,
differently.
yeah.
And that's what, again, I hope that we're doing with direct composite is I hope that our profession can look at things differently. Look at
Mm,
direct composite differently than we have in the past, and see it as a new opportunity to do things in a different way that might even be better than some of the things
mm,
that we used to do in the past. But I think that principle we can expand to every other aspect of our lives, right? If
yeah.
we feel like we're stuck in our physical bodies, that we're not healthy or we're not active or we're overweight or we're just not where we want to be, okay, well, how can I change the system? Like, what can I do
Mm,
differently and try something new that can get me out of that? I think you just apply that to any part of your life and find exciting results because of that, or at least learning opportunities.
I want to ask you so many other questions, but I think this is a good spot to end.
All right.
Otherwise, I'll keep you here like for hours. So, thank you
Yeah,
so much
yeah,
again.
totally my pleasure, Jamie. Thank you.
This has been amazing, and you're such an inspiring person in cosmetic dentistry, and I can't wait to see the textbook that you're going to release and the
Thanks.
things that you will continue to pave our way in cosmetic dentistry. So I hope to meet
Thank
you one
you. Yeah,
day.
I'm sure we will someday.
How can people reach you?
Yeah, either messaging through Instagram at Marshall Hanson Dentistry or on my
Mhm.
website at marshallhansondentistry.com. Those are really kind of the only two platforms that I'm using. Try to
Yeah,
minimize things. So, but yeah, through
make
there,
it simple.
generally you'll get me if it's me responding rather than someone else. So if you reach out to me there, I can happy to respond.
All right. Thank you. Awesome.
Thanks, Jamie.